Right now, the wealthiest, most scientifically advanced country in history is being brought to its knees by a virus it knew was coming.
I view it as in a sense, a wartime president. I mean, that's what we're fighting.
We're at war with the virus.
Wait, is America at war again?
America is not at war with COVID-19. War is the wrong metaphor, and the military is the wrong tool to address it. But military spending is, in part, how we got into this health crisis in the first place.
The U.S. is not ready for this pandemic because the government has been spending enormous sums of money over the past 2 decades on war and war preparation. And our society remains well suited for war, even as investment in public health, education, and infrastructure have all atrophied.
Let's put it into context. The wars in Iraq and Afghanistan since 2001 have cost us over $6 trillion. By contrast, this year's budget for the Food and Drug Administration, the Center for Disease Control, and the National Institute of Health is just $48 billion. That's 1% of the total of the cost of the global war on terrorism.
Can you believe that?
And Donald Trump's total war-related budget for this coming year? $1.2 trillion. That same budget makes ill-timed cuts to funding for the Department of Health and Human Services, including the CDC and FEMA. But with the rest of the US government so hollowed out, it's no wonder we look to the military to support our weakened public health care structure. But that purpose can be redefined by investing in health and economic well-being at home. To address this pandemic, public resources must be directed now and moving forward to civilian public health.
Bill is passed.
Paying for the coronavirus stimulus deal with deep cuts to the military budget for at least the next several years would also go a long way towards reorienting us towards human security.
This crisis allows us to fundamentally rethink what national security actually means, to focus on the real threats to our well-being, which are ill health and inequality. Addressing those problems requires that we invest much more robustly and directly in civilian solutions.
So next time, we're not waiting for the military to save us from a public health crisis.